PASAE. Today's webinar, hosted by PASAE in partnership with the PA Department of Health, a very important topic that we're glad you're able to join us this afternoon. Certainly as an industry, we've been spending a lot of time talking about this topic. So we're very fortunate to be able to host this discussion with state officials as everybody continues to navigate life in the pandemic. We also recognize that each of you bring your own perspectives and thoughts around what is happening. So we thought it would be helpful for everybody to hear firsthand from the department about the steps that are being taken and where things are with the vaccine and the current cases. Questions can be submitted via chat. If we have time, we will certainly take questions that we can send to the department after. The questions that many of you have submitted ahead of time will be read to them and they'll be able to address as much as we can today. Today we are joined by the Pennsylvania Acting Physician General Dr. Denise Johnson and the department's Office of Intergovernmental Affairs Director Meaghan Abbott. We thank everybody for participating in this discussion and certainly thank our esteemed guests. And before we jump in, I would pass it over to our presenters to see if there's anything that they would like to share before we jump into the questions.
Well, good afternoon, everyone. Thanks for having us. Looking forward to talking with you this afternoon. Just want to mention that I know that we're all ready for this pandemic to be done. And right now we're in the vaccination phase, but we're already seeing some positive benefits of vaccination, although we still have a ways to go. I think most of you have been, keeping up with highlights and seeing that the cases in the over 65 age group have really been going down tremendously. And I think Pennsylvania is about 92+% of those over 65 years and older who have been vaccinated. So cases that we're seeing, more of the cases that we're seeing now are in the younger age group, also seeing hospitalizations in those areas as well. But also more good news is that it looks like the rise in cases that we've had has really slowed down. We have been plateaued for a little bit, but now it looks like it's going down. So definitely having the impact. We've recently seen some studies about modeling of cases to project into the future about how we're doing. And so those models look like if we can increase the pace of vaccination while we're doing all the things that we've been doing to keep us safe, we can have a significant drop in cases pretty quickly within the next couple months. If we are not vaccinating as fast, or if we're not using any of the measures that we all know that we should do, distancing, masking, all of that, then it'll be slower for the pace. So what we're doing is trying to pull out all the stops, get access to everyone, get information to everyone so that they can make that decision to get vaccinated. And really trying very hard to get more people vaccinated. But we need all of you to help to advocate within all of your circles. So I'll stop there. And I don't know if Meaghan has a few words to say before we go on.
Thank you. Hi, everyone. I see a couple familiar faces from working with several of you throughout the pandemic. So it's good to see some of you and to meet others. I think we'll do our very best to answer all your questions today. We're happy to follow up with Pete as needed. And also something to keep in mind is that our team is really happy to take the vaccine show on the road. So if you all have other organizations, your members, your folks, we're happy to present, talk, give you resources over the next couple weeks. Whether it's Dr. Johnson and I, we're happy to talk about vaccine all the time.
Great, thank you both. I will jump in with the first question. Many of our members work in the hotel industry or are responsible for planning in-person meetings. What can you tell us about when restrictions will be further loosened or when we might expect to be fully opened?
This is a very timely question. Earlier this week, we did announce, the administration announced that We will lift mitigation orders, the state orders, other than masking on Memorial Day. And then we will lift the masking order when 70% of Pennsylvanians age 18 and older are vaccinated. So I think I've talked to many of you about the mitigation over the past several months. I know it has been a real sacrifice for many of your businesses, but you've really done it to help public health, and we're really appreciative of you. And Memorial Day is the day those in the hotel industry will be able to increase their gathering sizes.
Great. And what kind of follow-up to the last question, what is the criteria used to loosen restrictions that we could look at or follow in the news?
So something we've always looked at really is the case numbers. And as Dr. Johnson mentioned, we've seen a plateau and we're starting to see a decrease. So that's something that's really important. We're also seeing more people be vaccinated. So just like the ability to remove your mask, please encourage your friends, neighbors, community members to get vaccinated to help us get to that point. We're really hopeful and that we'll be able to keep cases low, that will not be seen, we'll be able to keep, vaccination rates high and cases low. I think that's our goal here. But these are all, I know all these questions were asked probably before the announcement earlier this week, but we're very happy to announce that some of the restrictions will be lifted.
Okay, there's several questions. The next few questions are related to opening offices. So the first question, what recommendations do you have on when we should open our offices, and what measures should we take to ensure it is safe?
So with the lifting of the mitigation order, offices, businesses will be able to be back at full capacity. That said, good public health tactics, social distancing, mask wearing, hand washing are still going to be important. There will be guidance and best practices. We'll look a lot to the CDC. I look to Dr. Johnson's clinical advice for the best way to mitigate disease, but that's really something that that's important, is just to continue to do those things. We've seen a really low numbers of flu cases during the pandemic. So I think it really goes to show that these types of efforts help keep us well from all, transmittable diseases like that. Pete, I hate to do this to go out of order, but I did just want to address some of the comments in the chat to kind of stay in track with each other, if you don't mind.
Absolutely.
So the emergency declaration will remain in place. That is a really important piece for us at the department, at the Commonwealth. The emergency declaration, as we know, will be on the ballot a couple days here. And it's really important for us. We've been given a lot of ability to do many things, including, emergency procurements, paying the National Guard, many different things because of the disaster declaration's privileges. The other question, is it safe to assume that the 6-foot guidelines will be included in the mitigation orders lifted on Memorial Day? So yes, the state mandated requirements will be lifted, but that doesn't mean, that best practices will go away in any fashion. We'll really look to much of the CDC guidance and other clinical guidance, while going back to work.
Can I jump in there?
Yeah.
So just a couple things to throw out here. As we talk about crowds gathering and people getting closer together, just make sure to remember, Meaghan said that we're talking all vaccine all the time, and that's really true, but make sure that all staff have access to vaccines, because as we start getting more people in your facilities, there are going to be unvaccinated people. And unvaccinated people is still a reservoir for the vaccine to spread. So as you want to protect your staff, make sure that they have access to vaccine. And we have quite a bit of availability, throughout the state, but just really stress your staff, their personal protection. And then the other thing in terms of emergency declaration, I don't know that people realize all of the freedoms that we've been able to have, the flexibilities that we've been able to have because of many of these waivers. And so we hope that many of these waivers will still be in place. We've had a lot of flexibility in our licensing, and I'm speaking personally for providers. So flexibility in providers getting their licenses, having some leeway in terms of renewal of those licenses. We've been able to utilize retired nurses or students who are about to finish their training to give vaccines and things like that. And from a hospital standpoint, where I'm coming from, we've been able to utilize additional beds to treat COVID patients or overflow because our hospitals have been full. So we certainly don't want those things to go away, even if some of the other things go away. Thanks, Meaghan.
I see a couple of questions that came through the chat in the midst of that conversation. If you all don't mind, I'm going to pose one of them now. And that question is, do we have a sense of what the number of residents needs to be at to hit the 70% vaccination mark?
I know I've been asked this question quite a few times, and I don't know that I had the answer before. But Meaghan, am I correct that the number of people that we're looking at is somewhere about 11.3 million total, and so 70% of that is somewhere in the 7.2 million, something like that. Is that correct?
I think so. I was trying to multitask and find the link for you. We are using the data on the CDC's website, and I was trying to multitask to find the right link for you where you can keep an eye on that and track it. I will, since I am poorly multitasking, I'll send it to Pete and Brandy after, and they can send out the link for you.
Thank you. Thank you. And I see one other question that came in that I'll pose now, and then I'll turn it back over to Pete. And that question is, given the emergency declaration staying in place, do you know if it means that waived and suspended licensing regulations will stay in place as well? Or is that a question that should be posed to the Department of State?
I believe they will stay in place, but I can follow up and confirm.
Thank you.
All right, next question along those lines of vaccination. Can employers require proof of vaccination?
So I don't know, what I can say. The department's position is we want everyone to get vaccinated with as few barriers as possible. I think I'd really look to I'm sure all of you have many lawyers or HR professionals that you work with to answer that question officially, but that's really our standpoint, is we want everyone to get vaccinated with as few barriers as possible. Yeah, I think I would defer that to a lawyer or an HR professional.
Sure, fair. If all employees have been vaccinated, which measures should we continue in the office, like mask wearing, social distancing, and does that depend on the number of employees that are in the office as well?
So
yeah, I would say I would defer to Dr. Johnson's clinical expertise. Yeah.
So according to the CDC, being indoors with other vaccinated people, mask wearing would not be necessary. Now, if you're in a group and it has vaccinated and unvaccinated people, then that would be different. So mask wearing would be recommended if there are unvaccinated people that are also in that group. I don't know if that's helpful.
Yeah, I think so. In considering each one of these, what health, safety, and legal implications should we be aware of when returning back to the office?
Similarly to your other question, I think the legal implications are best with a lawyer, but the health implications, I think all of the things like Dr. Johnson just said, as well as just a general healthy workplace. We talked about low flu numbers. I think Dr. Johnson, is there anything else you want to add? We've talked a lot about lots of information about, variants out there and the importance of keeping everyone well with mask wearing and hand washing.
Well, yes, if you're using a reusable mask, please wash it. I think that other things that you've been doing already during the pandemic, right? I think that before the pandemic, we really didn't think about airflow in our facilities and, ventilation, that sort of thing. So all of those things I think are going to continue to be important going forward. Regular, trying to not be very crowded, making sure that employee staff have ability to do frequent hand washing, just the normal type of hygiene of a facility. I think that recent guidance from the CDC indicated that we don't have to have such extreme measures in terms of sanitizing, but just regular frequent cleaning practices would be recommended.
Next question, what should we expect in the next coming months to continue to make vaccines accessible, and how will you help dispel vaccine hesitancy?
So, and Meaghan can speak to this as well. There are a lot of activities that we're doing right now. They're focused around education and access. And so that, we had started out, our initial strategy was to get as many people vaccinated as quickly as possible. So we had mass vaccination sites that could have a really high throughput of people through there. Now that we've had a little bit less demand for those mass sites, we are expanding our provider network so that we could get closer to people, so that there's a lot more convenience in terms of getting vaccinated. We also are trying to provide education. So we're going to have a huge mass media advertising campaign. So you'll see it all over the airwaves, radio, print, social media, encouraging people to be vaccinated. But we also have hosted and will continue to host things like town halls so that people can do question and answer. We're also providing local grassroots organizations and groups with credible information so that they can disseminate to their local networks. So working in a mass media as well as targeted to individual communities and individual stakeholders in those communities to make sure that they have credible information. We're also doing public service announcements. We're doing those in different languages, in different areas, by physicians, by local people, so that there can be questions that are answered that way as well. And then we're also open to other ideas, anything that we're not already doing. If people have ideas of things that might work or that we might want to try, we're open to those as well.
I did put in the chat box our PA Unites Against COVID, which is my background today. Information, there's a resource library that will be populated as the vaccine campaign really gets rolling. But there's a couple things you can find in there right now, right away, FAQs and some other info. And we'll be sharing, and Pete and Brandy will make sure you're starting to receive information. But that's a good place to start if you need something immediate.
Great. I think you guys answered the next question we had about how can our group help dispel myths, connect their members to this information. So it sounds like your recommendation is to go to that site and again, promote that. You mentioned grassroots. We have lots of different associations with a variety of backgrounds. So it sounds like you're encouraging everybody to go to that site.
One more thing to add. Oh,
go ahead. No, go ahead. Go ahead.
So one more thing to add. We found that something that's been really powerful are when vaccinated people speak to their contacts about just the experience of being vaccinated or why they got vaccinated. Your close contacts really listen to you and trust you, and knowing that you've been vaccinated and being able to tell your story can be very powerful. So don't overlook that outreach, because that's really, really important. I'm sorry, Meaghan.
Oh, no, I was just going to add, like I said earlier, if you would like someone from the department, we're working very closely with the governor's affinity commissions, so Latino Commission, Commission on African American Affairs, working with lots of those experts in their field. If you would like any number of people to come talk to your members about vaccine hesitancy, share PowerPoint, share materials, resources, we're happy to coordinate it. You can reach out directly to me, or I'm sure Pete can find me if you want to catch up with him.
We have another question here in the chat, if it's okay to share that now. And that question is, what guidance are you giving to schools for the fall? Are there plans in the works with the Department of Education to provide any back to school guidance after the restrictions have been lifted?
Yeah, we work really closely with the Department of Education. I see that question's from Mark. Hey, Mark, I got to talk to him a couple months ago. Yeah, we'll work really closely with PDE, but on, I guess, the 31st, the 1st of June, the attestation that schools had to do will also be lifted. So the mitigation in that setting will be relaxed as well. But the short answer is yes, we'll continue to work with PDE on appropriate guidance.
All right, back to, we have a few more vaccination questions. The next one is, how soon will individuals have to receive boosters if they've been already given the vaccination? And what are the thoughts around the requirement of boosters going forward?
I think there's been a lot of conversation about boosters. I know that Pfizer has been working with their boosters. We've heard recently today that Moderna has been doing some testing with a booster of the current vaccine that they have available now, as well as a newer formulation of the vaccine that's been tweaked to be able to be a lot more effective against the South African variant. So a lot of that still is in development. There's not anything definitive yet. I know that some countries are looking at starting. I think I've heard in the UK they're considering starting in the fall with the booster, but there's been no recommendation on that yet. So we're following that closely, but there's not a requirement yet for boosters, although that may be coming, but we'll keep posted.
Great. And what uncertainties continue to exist around vaccinations, and what impacts could they have?
So I think the greatest uncertainty that I see are people, especially younger people, who don't feel the urgency to get vaccinated. So I think that, not everyone is clear that vaccine are very effective and decrease the chance of getting COVID, but especially severe COVID or being hospitalized is tremendous. I mean, it's better than any vaccine that we've had to date. So all three of these vaccines are very, very effective, very safe in terms of side effect profile. And again, we've really not seen other vaccines in all that we've been using that have had such good side effect profiles. So I think people don't realize the urgency that even with mild cases of COVID, some people do have long-term effects. And so that the vaccine protects you against that, and vaccine gives you a lot better immunity going forward in terms of the immune response than the natural disease. So there are still, I guess, people who don't realize that there is an urgency to that. And the other urgency is that, while there are unvaccinated people, there is a reservoir for for the virus to keep circulating. And as the virus keeps multiplying, that's how we get more variants. And we have variants of concern now that we're watching. Right now, the vaccines are still effective against them, but that may change if we have other variants that develop. And so not only can it affect the effectiveness of our vaccines, but it also can affect the effectiveness of the treatments. We have monoclonal antibodies that people who are at high risk when they develop COVID can be treated with these antibodies that can keep them from being hospitalized or getting severe. We already know that one of the monoclonals that we were using alone is not as effective now as we've got more variants. And so we've had to pivot and add another monoclonal with that to treat patients. So as we have more virus circulating, there's more chance of mutations that can take away some of the tools that we have to fight the pandemic.
This is the last submitted question, so we certainly have time for those if you'd like to submit a question via the chat box. The last question is, as you review all the measures and steps taken over the course of the pandemic, are there things you'd revise, change if we live through something like this again?
So I'll let Dr. Johnson chime in as well, but I really think that we, one of the most important things is that we have the opportunity now to really transform public health. I think COVID didn't necessarily, created many problems, but it also highlighted so many that already exist. Access to healthcare, quality insurance, education levels, quality employment, social safety nets. COVID has really highlighted a lot of issues that we've already seen. So I think by really learning these hard lessons, we'll be able to be more prepared going forward and to rebuild the public health infrastructure. Pennsylvania's, we're in the bottom half, the bottom quarter of public health funding nationally in PA. So I think the biggest change I would like to see is, better public health infrastructure, both at the department and I think across the Commonwealth.
Thanks, Meaghan. You hit the nail right on the head. I think that, as a nation, we weren't prepared for what this pandemic brought. And I don't think anyone was across the world. But as Meaghan said, we really saw gaps really magnified. And so I think our charge right now will be to shore up those gaps so that we would be better prepared if we have to face something, anything like this again.
Thank you. Thank you both. We did have another question come in here via the chat. And that question is, are you making any recommendations in regards to meetings and conferences about requiring either a vaccination or a negative test to attend the event in order to slow the spread?
I think
not at this time, yeah. Oh, sorry, Dr. Johnson, yeah.
No, I think we've always gone to the CDC guidance for, those sort of issues. So there's not anything coming out of the state right now that would be in addition to CDC guidance.
Yep.
Thank you. I'm just rolling through the chat to make sure that I have not missed any questions that were posed.
Brandy, if it's helpful, something we're asked very often, that I personally find comforting to hear from Dr. Johnson is about hesitancy with women, breastfeeding women of childbearing age, fertility issues. That's a question I get very often, and I'm sure she'd be happy to talk about.
Sure. I think just to mention, I think that just from the American College of Obstetricians and Gynecologists, the American Society for Reproductive Medicine, and the Society for Maternal Fetal Medicine all recommend that pregnant or breastfeeding or people who want to become pregnant be offered the vaccine. There are clear studies that show that pregnancy risks, including all of the negative outcomes, miscarriage, stillbirth, all of those are worse with COVID. Pregnancy outcomes are worse with COVID. And pregnant women are at higher risk to be hospitalized, to have negative outcomes with COVID. We've also had some preliminary studies with, I think was recently published in the New England Journal of Medicine, of 35,000 women who were pregnant and who received vaccines and had no more negative outcomes than women who have not been vaccinated. Also, in terms of the immediate side effects, I think that there was concern that pregnant women would have more side effects, and that has not been the case. And so these societies do recommend vaccination as being safe for pregnant women. There has also been some recent studies that show that the antibodies that are produced after vaccination for COVID do cross the placenta and may offer some protection to the infant. So the vaccines do not should not have a negative impact on fertility or pregnancy or breastfeeding, and are definitely recommended. And so I always recommend that women speak with their obstetrician, gynecologist, and they are definitely recommending vaccines. And I think many of them, even who have been pregnant themselves or are pregnant, have been vaccinated. I think we have heard that over 90% of physicians have received the COVID vaccine. So, we strongly recommend it and believe in it for ourselves and our family members as well.
Thank you. We've got two more questions, and actually three, I'm sorry. Dr. Johnson, can you talk a bit about the upcoming vaccine for children? Many of our members have children, have small families, and so I know that's been a lot of discussion in various spaces. If you could speak to that.
Sure. So all three of the vaccine makers for the vaccines that are approved here in the United States have been doing testing with children. And Pfizer has already requested the emergency use authorization for their vaccine for the 12 to 15-year-old. Remember that Pfizer is approved now for 16 and above. And I understand that that approval might be coming as early as sometime next week. So, I think early on, we've learned a lot about this virus because there's so much that's unknown and so much we keep learning. But I think we thought that, younger kids really weren't getting infected with the virus and certainly weren't getting sick. We know now that that's not true, and especially since, again, a lot of the older people have received the vaccine and are immune, we are seeing cases in younger children. And so not only in the, sort of adolescent age, but even younger. So young kids still are at risk, certainly, maybe not as high risk as the elderly, but they are at risk. And we do see severe disease in children. I'm sure you've heard about the multi-system inflammatory reaction that some kids can have. We certainly have had that in Pennsylvania, and we certainly have had deaths in children as well. So that the vaccine is available, it is recommended. American Academy of Pediatrics does recommend vaccine as well. And so always, if there's concerns, speak with your doctor, speak with your child's pediatrician, and, they know the particular condition of the child and whether or not they would recommend it. So always reach out to them, but that would be recommended. There are trials going on for younger children as well. And so that we'll probably hear about more later on. It probably will be several months before we do have that. But remember, the more people that are vaccinated, the less reservoir the virus has to circulate.
Thank you. We've got two final questions and we'll wrap our session today. One question here is, with the mitigations and restrictions being lifted at the end of this month, does that mean that indoor events and meetings will not have restrictions on the number of attendees? And will that mean that the 6-foot distancing will be removed when it comes to seating and the like?
Yep, yes. The mitigation order, which I can drop into the chat box, just for everyone's reference, will expire on the 31st at, I think, 12:01 a.m. So it will expire. And the state requirements will be lifted. I think that's not to say that best practices shouldn't be followed with 6-foot distancing and so on. But our state gathering size restrictions will expire at that time.
Thank you. And one final question. Many of our associations have members that work directly with the public, but may feel hesitant about broaching the subject of vaccination with their clients. Any thoughts for how to best approach what they can pass on, what we can pass on?
So, yeah, that's a difficult one, as you rightly recognize. I think that we've seen reports in the news about very negative and severe interactions that occur when people are confronted about vaccination or mask wearing and all of that. So I think the best that I would recommend is making sure that your staff are properly vaccinated to protect themselves, and realize that if we have a crowd of people, there are going to be unvaccinated people in that crowd. So first thing you could do is protect yourself and staff by making sure that they're vaccinated. And to this point, if there are going to be unvaccinated people within the crowd, make sure that people are masked appropriately. I think there's not any easy way to require everyone around you to be vaccinated, but you could just be a great ambassador for vaccination and, encourage your contacts. I don't know if you want to add anything, Meaghan.
No, I think we'll be having more and more resources being developed that please use them, steal them, take them off our website. I also think Dr. Johnson and some of our other physicians and clinical folks are a really great resource for other organizations' information. So if you ever have very specific audience that you have questions about, we can always hunt down the resources for you if you need them from another organization like the ACOG, the Gynecologists Association, or pediatrics. We can find specific information if we don't have it created, I think, or we could work to create something that's helpful for you.
All right, there was one other question in the chat, and I can share that now, and then Pete, we will be ready to wrap here, if that's okay. We had one more come in. I didn't want to miss this. Can you talk more about what the effects would be if the constitutional amendment passes?
Go ahead, Dr. Johnson, I'll let you go first. I know you've been answering this one quite a bit.
So I think the concerns we have in terms of health, and I can speak from hospital physician perspective, there are a lot of flexibilities that we could get because of the declaration, and we have an interest to make sure that those things are seamless as long as we're in the pandemic. So just an example, I came from a hospital, and so when we were having an influx in COVID patients, we needed to create some negative pressure rooms right away. We needed to shift patients from one part of the hospital to the other to, keep them confined. All of that would have required pre-planning and permission before we're able to move those patients. In terms of getting people extension of their license because they couldn't go in to, do the things that they needed to do, where they had to have an in-person exam to be able to do that virtually. All of those things need to happen in real time. And so not being able to do that would have really impacted the care that we could give to patients. So from a public health standpoint, we really want to make sure that we have those latitudes to be able to do, but we also don't want them interrupted, right? We don't want there to have to be a lot of conversation whether or not this can continue so that we can take care of patients. So from my standpoint or my perspective, those are the things that I see. And there are a lot of other things that were affected by that, right? Being able to get your driver's license extended without going in, there are just a myriad of things that I think that, we may not even think about.
I have some notes I can send you, Brandy or Pete. You're welcome to share them. It details a little more, Dr. Johnson really spoke from our DOH sort of health swim lane, but it definitely impacts other organizations like PEMA for future disasters. Small town flood would be impacted with this change. The Department of Human Services, it would affect emergency SNAP allotments that really help people put food on the table. So there's a quite a cascading effect, but I'm happy to send this over and you can feel free to share.
Thank you. Thank you. Well, I believe we've covered all the questions that were placed in the chat. And Pete, if I'm correct, we've covered all the submitted questions as well.
Yep, absolutely.
Well, we thank each of you, Dr. Johnson, Meaghan, thank you so much for taking time out of your schedules to connect with PASAE's membership this afternoon and to have this very engaging conversation. And to all members here in the chat today, thank you for taking time to be here and to be a part of this conversation. We look forward to continuing to connect with the department. We'll provide follow-up materials to you as noted. And again, thank you all for your time and engagement today. We wish you a great afternoon and weekend ahead. Again, thank you all so much.
Our pleasure.
Thank you.
Take care.
Thanks, everybody.